Stomach infection or food poisoning, sudden vomiting. Sharp stomach pain. It could be food poisoning, not just a stomach bug. Stomach infection or food poisoning, sudden vomiting. Sharp stomach pain. It could be food poisoning, not just a stomach bug. Welcome to WA Health and Care. Today, we'll explain the difference between stomach infection and food poisoning, including causes, symptoms, treatments, and prevention. Following advice from UK and USA specialists like Dr. Emily Carter and Dr. James Holloway, will guide you on how to stay safe and healthy every day. What is stomach infection or food poisoning? A stomach infection and food poisoning may feel similar, but UK and USA gastroenterology specialists explain that both conditions have different sources. At WA Health and Care, we break it down in a clear and trusted way so viewers understand exactly what's happening in their body. A stomach infection, often called gastroenteritis, usually spreads from person to person. According to leading UK and USA doctors, common viruses such as norovirus, rotavirus, or adenovirus can irritate the stomach and intestines. This leads to symptoms like nausea, vomiting, diarrhea, stomach cramps, and low-grade fever. You can catch it through close contact, touching contaminated surfaces, or being around someone already infected. In comparison, food poisoning comes directly from contaminated food or drinks. USA and UK health specialists confirm that bacteria like E. coli, Salmonella, and Campylobacter grow in improperly stored, undercooked, or expired foods. Symptoms often start very suddenly, sometimes within hours, and include vomiting, sharp abdominal pain, watery diarrhea, and dehydration. In simple words, stomach infection spreads from people and environments. Food poisoning comes from spoiled or contaminated food. Both conditions can be managed, but if symptoms worsen, UK and USA doctors recommend seeking urgent medical help. What are the causes of stomach infection or food poisoning? Understanding the causes helps you identify the problem early, and at WA Health and Care, we follow guidance from UK and USA gastroenterology specialists to explain it clearly. A stomach infection is mainly caused by viruses, bacteria, or, in rare cases, parasites that spread from one person to another. According to UK and USA infectious disease experts, common viruses like norovirus, rotavirus, and adenovirus are the leading triggers. These germs spread through contaminated hands, unclean surfaces, public places, shared washrooms, or close contact with an infected person. Poor hygiene, not washing hands properly, and consuming unsafe water also increase the risk. On the other hand, food poisoning happens when someone eats or drinks contaminated food. USA and UK food safety specialists confirmed that bacteria such as Salmonella, E. coli, Campylobacter, and Staphylococcus aureus grow rapidly in foods that are undercooked, expired, left unrefrigerated, or stored incorrectly. Contaminated street food, raw meat, unwashed vegetables, or dairy products kept at warm temperatures can also lead to food poisoning. Sometimes toxins produced by these bacteria cause sudden and severe symptoms. In simple terms, stomach infection spreads from people and dirty surfaces. Food poisoning comes from contaminated or poorly handled food. What are the symptoms of stomach infection or food poisoning? Recognizing the symptoms early helps you respond quickly, and at WA Health and Care, we follow guidance from leading UK and USA gastroenterology specialists to explain them clearly. A stomach infection usually develops gradually over 24 to 48 hours. UK and USA doctors explain that viral or bacterial infections irritate the stomach lining, causing nausea, vomiting, watery diarrhea, stomach cramps, bloating, mild fever, loss of appetite, and weakness. Some people may experience body aches or a slight headache due to dehydration. These symptoms often start mildly and slowly increase as the infection spreads through the digestive system. In comparison, food poisoning usually begins very suddenly, often within 1 to 6 hours of eating contaminated food. USA and UK health specialists report symptoms such as intense vomiting, sharp abdominal pain, frequent watery diarrhea, nausea, and sometimes chills or sweating. Dehydration can happen quickly because the body loses fluids rapidly. In severe cases, there may be blood and stool, which requires urgent medical attention. In simple words, stomach infection builds up slowly with fever and weakness. Food poisoning hits fast with strong vomiting and stomach pain. What are the treatments plus medicines for stomach infection or food poisoning? Treating these conditions requires careful hydration and symptom management. At WA Health and Care, we follow guidance from leading UK and USA gastroenterology specialists to share clear, safe, and general information. For a stomach infection, UK and USA doctors emphasize that hydration is the first and most important step. ORS, electrolyte drinks, clear soups, and diluted juices help replace lost fluids. Over-the-counter medicines like paracetamol, acetaminophen, can help reduce fever and body aches. In many viral infections, antibiotics are not needed because viruses do not respond to them. However, if a doctor suspects a bacterial infection, they may prescribe antibiotics such as azithromycin or ciprofloxacin, but only after proper evaluation. Never use antibiotics without medical guidance. For food poisoning, treatment again starts with restoring fluids. UK and USA health specialists recommend oral rehydration, light meals, and rest. Medicines like loperamide can help control diarrhea temporarily, but experts warn it should not be used if there is high fever or blood in stool. Some cases require prescription antibiotics, such as metronidazole or ciprofloxacin, but only when a qualified doctor confirms bacterial contamination. What are the preventions and precautions for stomach infection or food poisoning? Preventing these conditions is easier than treating them, and at WA Health and Care, we follow guidance from trusted UK and USA gastroenterology and public health specialists to share clear and practical steps. To prevent a stomach infection, UK and USA doctors strongly recommend maintaining strict hygiene. Wash your hands with soap for at least 20 seconds, especially after using the restroom, before eating, and after being in public places. Avoid touching your face with unwashed hands because viruses like norovirus spread easily through contaminated surfaces. Regularly clean commonly touched items such as doorknobs, phones, and kitchen counters. Avoid sharing utensils, towels, or drinks with anyone who has vomiting or diarrhea. For food poisoning, prevention starts with safe food handling. UK and USA food safety experts advise keeping raw and cooked foods separate, refrigerating leftovers within 2 hours, and ensuring meat, poultry, and eggs are fully cooked. Always check expiry dates, avoid reheating food multiple times, and wash fruits and vegetables thoroughly. Be careful with street foods, salad bars, or buffets where food may be stored improperly. Hydration also plays an important role. Drink clean, filtered water, and avoid unsafe water sources when traveling. In simple words, clean hands prevent stomach infection. Safe food prevents food poisoning. Thanks for watching WA Health and Care. Remember, understanding the difference between stomach infection and food poisoning is key. Follow hygiene tips, safe food practices, and hydration advice from UK and USA experts like Dr. Emily Carter and Dr. James Holloway. Stay informed, stay safe, and protect your digestive health every day.